Good afternoon, everyone, and thank you for joining our Good Health Gateway sponsored webinar today. The topic of today's webinar is diabetes and hypertension. What's the connection? My name is Linda Loisel, and I'm the Vice President of Operations at Abacus Health Solutions. We're bringing you this Good Health Gateway webinar today, along with the Good Health Gateway program. I want to review a couple of housekeeping items before we turn the presentation over to our presenters today. We are going to allow for questions during the presentation, and you will be able to ask questions through the GoToWebinar platform. On the right-hand side of your screen, you should see the opportunity to ask questions. And feel free at any point during the presentation to type your question in. You can send the question to us privately or have it displayed so that everyone can see the question. At the end of the presentation today, we are going to attempt to answer all the questions that we have received. But if by chance we're not able to get to your question, we will address those after the presentation and make sure we send those out to the entire group. I'd also like to point out that there's a handout attached to our presentation today. This document contains helpful resources that we will reference throughout the presentation. You can feel free to print this or download this document to use at your convenience following the presentation. Lastly, I also want to highlight that the presentation today is being recorded, and it will be able to be viewed on our Good Health Gateway YouTube channel in the days ahead. So I'm going to introduce our speakers, and then we'll get started with our webinar. I'd like to introduce Dr. David Ahern and Cindy Sylvia. Dr. Ahern is a nationally acclaimed behavioral research scientist and informatics expert. He is an associate professor of psychology at Harvard Medical School. Dr. Ahern ensures that the Good Health Gateway programs and services incorporate the latest evidence-based approaches to patient engagement and the promotion of healthy behaviors. Cindy Sylvia is a diabetes nurse educator for the Good Health Gateway. She has been an RN for over 30 years and has worked in many diverse areas, including acute care, home care, public health, as well as teaching nursing students. Cindy was recently elected as chairperson for the Rhode Island Certified Diabetes Outpatient Educators Continuing Education Committee. So with that being said, I'm going to turn the presentation over to David, who will be providing us with an overview of hypertension. David?
Thank you, Linda. I will offer a welcome as well and appreciate the opportunity to present to you today. So we'll begin with what is high blood pressure. And often people have a sort of a hard time understanding what it represents when we talk about blood pressure measurement. So high blood pressure, or hypertension as it's called, is the pressure in your arteries, and it's when it's higher than it should be, it's considered either elevated or hypertension. And it's usually expressed as two numbers. And this graph shows you, this chart shows you the top number is the systolic pressure, which is when the heart beats, and the lower number, the bottom number, is the diastolic pressure, when the heart is resting between beats. And it's measured in millimeters of mercury, or mmHg, which is really the measure of pressure. So that's how we measure blood pressure. And hypertension is, again, when it's higher than it really should be. And we'll talk about the categories of high blood pressure in a bit. What we know from a lot of research and studies is that nearly half of the American population over the age of 20 has high blood pressure. And the real problem is that many people don't even know that they have it. And the reason for that is oftentimes there are no symptoms associated with having hypertension or high blood pressure. So it can be sort of a silent issue for people, but it is a major health concern. So the American Heart Association, the American Medical Association has really focused on this challenge of uncontrolled blood pressure or high blood pressure or hypertension in the United States. Over 39 million Americans are at risk for having some serious health issues related to uncontrolled high blood pressure. We noted that 46% of adults have high blood pressure in the United States. Recently, a lot of work has been done to sort of update the guidelines. There are new categories for different levels of blood pressure, and we'll present that in a moment. But there's actually a new guideline for the target for lowering blood pressure with treatment to 130/80 millimeters of mercury. And the emphasis on measuring blood pressure is to take blood pressure more routinely at home, or self-measured, what's called self-measured or self-monitored blood pressure, in addition to what might happen when you go to the doctor's office and have your blood pressure taken. The science indicates that the blood pressure, when blood pressure is taken at home over time, it's actually a better predictor of further future complications related to having high blood pressure. So it's an important new development, and one that we want to recommend, and we'll talk more about in our the program that the Good Health Gateway offers. I mentioned to you about the new category. So this is a very nice and fairly easy to read chart from the American Heart Association, where they call it Know Your Numbers. And this is a good way to kind of see where you fall within the different blood pressure categories. So we mentioned 120/80 is the 130/80 is the sort of target for high blood pressure, but normal blood pressure is typically considered less than 120/80. In the 120 to 129 for systolic and greater than 80 is thought to be somewhat elevated. The high blood pressure first stage is 130 to 139 and 80 to 89. And a stage 2 is 140 or higher for systolic and 90 or higher for diastolic. And then there's this final category, which is really a hypertensive crisis, where you really would want to consult your doctor immediately if you have blood pressure higher than 180 for systolic or 120 for diastolic. So knowing your numbers is important, and you can get these numbers by doing home-based monitoring using a blood pressure cuff and gathering that information over time. So the title of our webinar today is The Connection Between Diabetes. What is the connection between diabetes and hypertension? And we have often sort of thought about this in ways that we could try to communicate the complexity here, that having uncontrolled blood pressure in and of itself is not good for your health over time. It has its own set of issues that relate to cardiovascular disease, heart attacks, stroke, and so forth. But in the context of with a person who has diabetes, it's even more of a concern, because it actually is one of the most significant factors in increasing your risk of having complications in the cardiovascular domain, but related to your diabetes. So really controlling high blood pressure when one has diabetes is really important. And that's sort of the take-home, one of the take-home messages for our presentation today. So with that, I'm going to now turn over the presentation to Cindy, our certified diabetes nurse educator, who will talk about the good news, which is there are things that you can do to both improve the management of your diabetes and hypertension. Cindy?
Thanks, David. Thanks, everyone, for joining us this afternoon. So diabetes and hypertension management. And just as David said, there's a lot of good news, good things that you can do. And we're going to go discuss this over the next few slides. In particular, it's important to speak with your provider and to develop a treatment plan. And the treatment plan should include lifestyle changes, which we'll speak about in a moment. And as David said, self-monitoring of blood glucose and of blood pressure, and medications, antihypertensive medications, if they're recommended and prescribed by your provider. So lifestyle changes. So as I said, it's essential to make a treatment plan with your provider. It's also important to review and revise that treatment plan every time you have a visit with your provider. Another lifestyle change that the physician provider may ask you to consider is the DASH diet. And what is the DASH diet? The DASH diet is dietary approaches to stopping hypertension. Studies have shown that the DASH diet can lower blood pressure in as little as 2 weeks. The DASH diet has also been shown to lower low-density lipoproteins, so the LDL or the bad cholesterol. Hypertension and high LDL are two of the major risk factors for heart disease. So the DASH diet has a significant impact. The DASH diet is a flexible and balanced eating plan, rich in vegetables, fruits, and whole grains. The DASH diet also includes fat-free or low-fat dairy products, fish, poultry, beans, and nuts. It's important to speak with your provider as to what dietary approach is best for you. And as Linda said earlier, we do have a resources page, and we do have a number of resources that we've added onto that resource page regarding the DASH diet. Another important lifestyle change that your provider may consider or have you pay attention to is hydration. Chronic dehydration can elevate blood pressure by making your body hold on to more sodium. If you are well hydrated, your heart does not have to work as hard. Thirst is not the best indicator. If you're thirsty, then you're already dehydrated. One of the simple rules to follow with regards to hydration is what we call the 8x8 rule. 8-ounce glasses, or a total of 64 ounces of water a day. Another great indicator is pale, clear urine is a great indicator as to hydration status. Weight is another lifestyle change that your provider may want you to consider. Your provider may encourage you to lose weight or to take measures to prevent weight gain. Blood pressure rises as body weight increases. Weight loss reduces the strain on your heart. Increased activity promotes weight loss. If you're able, gradually increase your activity. The recommendations are 150 minutes of moderate intensity aerobic activity per week. And what do you mean? What do you say? Moderate intensity, it's a brisk walk. It's important to move often. Your provider, so moving on to the next bullet, your provider may ask you to increase your physical activity if you are able. Regular physical activity helps you to lower your blood pressure. It also lowers blood sugar, also helps in controlling weight and decreases stress. So this is a win-win-win-win. Physical activity should be spread out throughout the week, and it's important to consult with your medical provider before starting an exercise program. Your medical provider may refer you to a physical therapist or an exercise physiologist before embarking on an exercise program. Alcohol consumption is another lifestyle change. Drinking too much alcohol can raise your blood pressure to unhealthy levels. Having more than 3 drinks in one sitting temporarily raises your blood pressure. And they have found repeated binge drinking can lead to long-term increases in blood pressure. It's very important to discuss your alcohol intake with all of your providers and your plans to decrease or limit your alcohol consumption. Finally, smoking. Every time you smoke or vape, it causes a temporary increase in blood pressure. Please talk to your provider to determine which treatment approach is best for you. So moving on, we're going to monitoring your blood pressure at home. As David said, monitoring your blood pressure at home can have a positive impact on your overall health. The more information, such as blood pressure readings, glucose readings, the more information that you share with your provider, during your appointment, the more the provider can evaluate the effectiveness of your treatment plan and make any changes if needed. The other positive thing with home monitoring is you can see how things are going in between appointments. You can see how what you're doing for changes in your lifestyle is having a positive impact on your blood pressure. One of the important things is the correct method to take your blood pressure at home. So here's a few of the steps, and we do have a more detailed discussion in our resource section, but it's important not to consume any caffeine and not to smoke 30 minutes before taking a measurement. You want to make sure that you sit quietly for 5 minutes before taking the reading. You want to sit in a chair that supports your back, such as a dining room chair or a desk chair. You don't want to sit on something soft like a couch or a recliner. You need to have both feet flat on the floor. You don't want to cross your legs. The inflatable portion of the cuff should completely cover 80% of your upper arm. The cuff should be placed on your skin and not over clothing. And you shouldn't talk while taking the measurement. The recommendations is to take your blood pressure twice and to wait 1 minute between measurements. If the readings are different by more than 5 points, it's important to check it again for a third time. Something important to note is that your blood pressure varies throughout the day. So it's important to ask your provider where your target blood pressure should be. And again, as I said, we've placed a video and some additional references to assist with the proper monitoring and taking of your blood pressure at home. So another important thing is monitoring your glucose at home. Actions that you take to control your blood glucose will in turn help to lower your blood pressure. High blood sugars can damage blood vessels, making them targets for hardening of the hardening or atherosclerosis, which makes hypertension worse. It's important to talk to your provider as to where your target blood glucose levels should be. Hypertension and medication. Your hypertension treatment plan may include prescription medication. Prescription medications taken correctly can be one of the most powerful tools that you can use. Even if you're not feeling any symptoms or if your readings have improved, please do not stop taking your medicine. It's important to discuss with your provider what is working for you and what is not working for you. Please always consult with the prescribing provider before taking any over-the-counter products, supplements, or remedies. And remember to discuss any concerns that you have about medications and side effects. The good news here is that many of the skills that you've implemented to care for your diabetes can be applied to your continued management of your hypertension. Please continue to exercise, please continue to take your medicines as prescribed, and continue to self-monitor your blood glucose and your blood pressure. And by all means, please continue to follow up with all of your providers as recommended.
All right, so thank you, Cindy, and thank you, David. We're going to talk on the next few slides about the Diabetes Care Rewards Program. So what exactly is the Diabetes Rewards Program and who can participate? Well, first off, we want to let you know that the Diabetes Program is a personal and confidential support program for people who have diabetes. And when we talk about diabetes, the program is available to anyone who has type 1, type 2, gestational diabetes, or even prediabetes. The program is designed to help you track and manage your condition. The program also provides incentives or rewards for completing certain diabetes care activities, and we'll talk a little bit more about those diabetes care activities on the next slide. The rewards are built into the program. So we'll show you through the registration process how you can identify what rewards might be eligible to you for completing the diabetes care activities. And then finally, we want to just make sure that you understand that this program offering is actually free to you. And actually the incentives in many cases are of a financial nature. Oftentimes the rewards and incentives include zero copay on diabetes medications and supplies, or perhaps your benefit offers you a monthly rewards on a wellness card that can be used to pay for healthcare expenses, or to be used to offset some of these labs and exams that we're asking you to do in terms of managing your diabetes. So let's take a little bit of a closer look at what those diabetes care activities are. We call these evidence-based standards of care. These activities should be probably familiar to you. These are activities that physicians are often asking their patients with diabetes to do. And so this program is really trying to reinforce what your provider is already asking of you. These include an annual lipid panel that we're asking you to have, along with a diabetes foot exam. And the foot exam actually can be completed by your primary care doctor, so you don't have to have a podiatrist. An annual eye exam, an annual urine protein test, and twice a year we're actually asking folks to have their A1C checked. Depending upon your own situation, your doctor may want you to have your A1C checked more frequently. And some folks that are in our program have an additional component of these activities, which includes an annual conversation with a diabetes care educator, such as Cindy. So how does one register for the program and learn more about what is specific to their own program? You can register for the program by going to www.goodhealthgateway.com or calling us at the 1-800 number that you see on the screen. When you go to the registration page, you have an opportunity to enter in the employer. This is an employer-sponsored program, so you would enter in the pull-down menu, you would select your employer, and then you can see where the first red circle is highlighting. You can learn more about the program. And in the Learn More section, that's where you'll be able to specifically identify the rewards and incentives that are that pertain to your unique program. You can log in and register for the program on your tablet, your computer, or your smartphone. It's very, very easy to register for the diabetes program. I do want to take a moment and just talk a little bit about privacy and confidentiality. The Good Health Gateway program is a sponsored benefit by your employer, but we want to assure you that your information is protected by our company. We follow all the HIPAA privacy and security standards, and we do not share any individual information back with the employer. So this program is private, confidential, and most importantly, secure. So I want to just take a moment and see if there are any questions. I'm looking in the application to see if we've received any questions. And I do see that we have a question here. I'm pulling it up. It's not easy to read for some reason. Okay, so someone is asking if the session will be recorded and they're not able to hear. So yes, this session is going to be available through our YouTube channel. It is being recorded, and we will share that information with all the participants after the broadcast. We also have another question that just came in. My doctor prescribed me multiple medications to treat my blood pressure. Is this common? David, could we ask you to handle that question?
Certainly, Linda. That's actually a very good question, and it is quite common. that it would that in order to achieve the targets for blood pressure control, oftentimes there is a need for 2 or even 3 medications. And the reason for that, in part, is that blood pressure is complex and there are different mechanisms or different ways in which blood pressure is influenced in the body by different parts of the body. And often the medicines are targeting different what are called mechanisms. So having 2 medicines is not uncommon, and it often is what makes it much more likely that you'll achieve control. In fact, the evidence suggests that taking 2 medications increases the likelihood by 5 times or more that you will achieve your blood pressure targets. So it is quite common.
Great. Thank you, David. Another question that came in is from one of our members. Can you elaborate on the DASH diet? Cindy?
Sure, that's a great question. And the DASH diet is a great method for someone with diabetes. It's in addition to promoting blood pressure control, the DASH diet has been shown to decrease insulin resistance, lower cholesterol, and contribute to weight loss. And again, it's a balanced approach of eating, variety of foods. So there's a lot of flexibility, and it's an acceptable pattern for people who have diabetes, but it's also very flexible for a lot of the other members of the family. So that makes it also an easy lifestyle change to be adapted by not just the person with diabetes, hypertension, but the whole entire family.
Great. Thanks, Cindy. I'm just reading another question here. It says, how long do I have to do brisk walking a day? Cindy?
So the guidelines is for 30 minutes of activity a day. The other thing is that you do not have to do all 30 minutes at once. You can do in short intervals. 3 10-minute segments have a cumulative effect throughout the day. So that's a great question because you don't have to do all 30 minutes at once.
Thanks, Cindy. And I think we have time for one more question. Can stress impact my blood pressure and my blood sugar? Cindy?
Sure. Yeah, stress. So when you're under stress, your body produces a surge of hormones. And these hormones can temporarily increase your blood pressure, causing your heart to beat faster and your blood vessels to become narrow. Now, there's no proof, and the researchers are still looking at it to see, does long-term stress or stress by itself cause an impact? But reacting to stress in unhealthy ways can increase your risk of high blood pressure. So, however, back to that walking, 30 minutes of walking can reduce your stress level. And if you have high blood pressure, doing activities such as walking can help manage your stress and improve your health.
Great. Thank you, Cindy. What I'm showing on the screen right now are some resources in addition to the resources that are available on the handout as part of the GoToWebinar platform. The handout contains helpful links on diabetes and hypertension management that you can use at your convenience following this presentation. So that concludes our presentation today. I do want to thank everyone for participating in the presentation, and I want to especially thank David and Cindy for their input and their collaboration on this great event. Thank you, everyone.
Thanks, everyone.
Thank you. Bye now.
Bye-bye.